What's the worst thing that could happen? You're sitting down with your patient, teaching them something new. And you think to yourself, I'm not sure if they're getting this. What's the worst that could happen? And then you think to yourself, ooh, they could get their dosage wrong and end up in the hospital, or worse, dead. That's not good. Or they might completely misunderstand their disease process and either think that there's nothing wrong or way more wrong than there actually is. They could, burn their house down? What? In February of 2015, a hospice patient staying at a friend's house lit a cigar in a bedroom full of oxygen equipment and subsequently burned that house down, landing himself and one other occupant in a bird's unit. Thankfully, no one else was hurt, no one died, but the house and all of its contents was completely destroyed. According to the hospice agency, they had educated the patient about the dangers of smoking around oxygen, and there were warning signs on all of the equipment. The homeowner, though, disagrees and even testified that he asked the nurse if it was safe for the patient to be smoking and drinking with all that medicine and stuff. The nurse said, "Go ahead, let him do what he wants," adding, "It's all right because he's going to die soon." As a healthcare worker, there's a little voice that lives inside my head that says, within reason, don't smoke around the oxygen. Whatever your philosophy about how people on hospice should behave, whether they should throw caution to the wind and smoke and drink and party all they want, or if they should give veganism a try, or maybe intermittent fasting or the paleo diet, or maybe they should make amends and develop a relationship with the God of their choice. Whatever your philosophy might be, you gotta admit that oxygen and smoking just don't mix. To most healthcare workers, that seems kind of obvious. It's a no-brainer, right? But what about everyday people? And if you think about it, even with everyday people, is this an everyday situation? Remember your last really stressful day at work? That day where you just couldn't seem to work the IV pump right, and then you paged the same doctor 3 times and you accidentally kept hanging up on him. Well, imagine that is how stressful your home life is. Imagine what sort of thoughtless mistakes you might make if all of that was foreign to you. New medicines, new equipment, old friend dying. How hard must it be to even think straight? Now, I'm not saying that the nurse was at fault by any means. It seems that the patient was thoroughly educated about the dangers of oxygen and smoking together. He even admitted that he knew better. The homeowner, too, had been nervous and had asked the patient to smoke outside. But I do wonder, what if the nurse had made one more plain language disclaimer? One more, but you might be a little loopy from all the meds, so be careful with the oxygen. He likes to smoke, so keep an eye on him. Would that have changed anything? As an aside, I did wonder when I started researching this video whether there would be HIPAA concerns about how she would educate a non-family member, and then I realized, she already said the guy was dying, so on the HIPAA ladder, I would think that dying is higher up than oxygen safety. We've all heard stories about doctors talking to patients using all kinds of incomprehensible jargon. I myself once witnessed a hematologist tell a patient that the problem with her platelets was that her bone marrow was not producing enough megakaryocytes, and she nodded like she knew exactly what he was talking about. But at least nowadays, most of us understand that we need to use plain everyday language when we're educating our patients. And there are techniques that you can use to make sure that you're doing a better job with that. Let's briefly go over a few of my favorites: plain language, teach back, and chunk and check. The Agency for Healthcare Research and Quality, which operates under the Department of Health and Human Services, put together a great document, AHRQ Health Literacy Universal Precautions Toolkit, 2nd edition. I'll include a link to this toolkit in the video description. Today, let's focus on tools 4 and 5. Communicate clearly and use the teach back method. And once we open this toolkit and we start reading around, this is where we learn the hope-inspiring tidbit that 40 to 80% of the information patients are told at their doctor's office they forget immediately, and about half of what they do remember is just plain wrong. Obviously, we need this toolkit. We need all the help we can get with this kind of starting point. Communicating clearly, aka using plain language, is just what it sounds like. Now, plain language to a healthcare worker is not necessarily the same thing as plain language to a layperson. Let's take a couple of examples. If you didn't know anything about cancer and your doctor told you that your cancer was progressing, would you think that's a good thing or a bad thing? I mean, we want to make progress, right? If you had a wound that your nurse practitioner told you wouldn't respond to local treatment, would you think that you needed to travel to get it looked at? Please forgive me, I know that sounds like a bad joke, but that is a real-life example that was given in this very toolkit. And how do we make sure that our plain language speaking is plain enough? We use the teach-back method. Basically, when we use the teach-back method, we just get the patient to tell us what we just told them. I know that sounds a little too simple, but that's how it works. Sometimes though, I feel like we might be a little afraid to ask the patient to teach us back what we just taught them. Like maybe they think that we'll think that they're stupid. But in reality, there are a lot of ways to go about this without being condescending. For example, one of my favorites. So tell me what you're gonna do when you get home. That can give you a pretty clear picture of how well they comprehended what you just taught them. A subset of the teach-back method is called chunk and check, in which we give chunks of information to the patient and they reflect back to us piece by piece what we've gone through. So, Nurse Faithy, what are you gonna do when you get home? I'm gonna talk to my patients using plain everyday language and not use big fancy nursey words. And I'm gonna get them to tell me what I told them so that I can make sure that they understand what I told them. And I'm not gonna overwhelm them with information. I'm gonna use chunk and check, which the term kind of makes me hungry, but it really means just to go over a little bit of content and then get the patient to tell me what I said, and then I can go to the next piece of content if they understood it. And that way they can keep up. Good job, Nurse Faithy. So for those of you who are wondering, in the lawsuit that we were talking about, the original court decided in favor of the hospice company and the physician, but then the plaintiffs appealed and the appellate court said, you know what, I think you've got a case. Let's throw out the first case and you can go ahead and keep suing them. So that's the last I know of it. If you know how this case ended up, I'd appreciate an update in the comments below. Also, if you have any thoughts or feedback or want to give me your favorite method for patient education, please leave them in the comments below and we'll have a great conversation. Thanks.